My name is Sami. I graduated from King Edward Medical University back in 2021. And then I got my first NHS job as a trust grade CT in urology at Oxford University Hospitals. And then after that, my second job is where I'm currently working as a ICU clinical fellow at Great Western Hospital in Swindon. So the topic I'm going to cover is mostly the trust grade jobs, which is, of course, mostly the first entry point for most of the IMGs coming from abroad. So, what I will try to cover is the overview of how the NHS recruitment process takes place, especially for the trust grade jobs, and what's the importance of securing the first role in NHS, how it helps you in building your portfolio for your training number, and then how is the transition when you shift for the from your back home house job done in Pakistan and then to the NHS. So, what are the pathways? How you can enter the NHS job market? So, there are various options to enter into the NHS. First of all, you have to take your, if you're an IMG, you have to complete your basic medical qualification, that is MBBS, back in your home country. And then people do their 1 year of house job. And then there's one option that after taking OET, you can apply for the standalone program, but that is competitive as well. So most of the students do that after their house job. They take PLAB 1 exam and PLAB 2 exam, complete their GMC registration, and start applying for the jobs. Another common pathway that is being started, because as the job market is becoming saturated, so the people are trying to take membership exams early. So that not only gives them a license to practice, but also helps them in like building their CV for specialty training in the future. So the first question after the candidates get the GMC registration is how to apply for the NHS job and where to apply for the NHS job. So when I used to apply for the NHS job, there used to be 4 different websites, which includes NHS jobs, track jobs, and then NHS Scotland, and then Northern Ireland NHS. And there was a private sector as well, that is NES. But recently I have discovered that there's a separate platform, separate website that has been launched. I think so. This is being run by the doctors, the junior doctors themselves. So that is known as Job Clerk. If I'm able to show you that, that would be great. This is that website. If you can see on the screen, you have to simply make your
Yeah.
login details, and it's a place where you can get all the jobs from 4 different websites. Like you don't have to look on the separate websites separately. Like don't have to go to the NHS Scotland, NHS Northern Ireland, and track jobs and NHS jobs. All the jobs are publicized here, and the time is written that this job was posted 2 hours ago, 3 hours ago, and you can know how many applicants have already seen these jobs. And then there are important filters you can set, like select regions, select the type of job, like medical doctor, and then you need to select junior or senior clinical fellow, and then you can take things forward and apply those filters. Similarly, you can select specialties as well. So you see the jobs here, and then when you click on apply now, then you go to the relevant website, whether it's on the track jobs or NHS jobs or Scotland. So I have found this platform a very, very helpful one. So you can use this one. And then after you've started applying and you start getting interviews, then there is an interview process. I will try to shed a bit of light on it, but that's an extensive topic itself. So what are the key challenges in finding the first NHS job? As Dr. Asif already discussed in his slides, that there are a number of challenges that have appeared now in the NHS, that the people are struggling to get into the NHS job as a trust grade fellow. But of course, it's not impossible, but becoming slightly difficult with each passing year. So the competition ratio has increased, aspirants have increased than the posts, and then they have to navigate through the different portals and have to meet the deadlines. Most of the applications get closed within 1 day or within hours because they reach the number of applicants. So you have to be very active in order to apply on different jobs. Like if you see a job on any of the website, just apply on it straightforwardly. Then afterwards, you don't have NHS experience. Then there are visa issues. There are multiple weak points in your CVs. And then there is an introduction of the PAs in the NHS that has taken much of the junior clinical fellows jobs. And then there is a new thing that is appearing in NHS now, which is a UK graduate prioritization. Although it's just in the beginning and nothing has been approved on a government level, but the BMA has started working over it, and it might get approved, and we might see some policy in coming months. So NHS job application, as it was covered in the IMT section, most of the things are the same. But while we apply for the trust grade jobs, I just want to show you one of my applications, that how does a trust grade job application looks like. Because when I started applying, I thought it would be much beneficial. I had known all of these aspects previously. So let me show you. So this is one of my job applications, which was for the clinical fellow in urology. So how does it start? The application, of course, starts with your personal details. Afterwards, you're taken to the qualification section. So you can mention all of your qualifications here. Like I have a certificate on medical education. I have a certificate, I have MRCS Part A, and then I have a BSc degree. You can mention all of your qualifications here. And then there is a section for relevant training courses. Like if you have attended any conferences, any BLS course, you can mention all of this here. And basic surgical skills, which I recently attended. Afterwards, the most important thing comes is the employment history. So this most of the organizations use this as a filtering criteria. They see how much experience do you have, or how much NHS experience do you have. So you have to carefully fill all of these details and use your house job as 4 separate columns. Like fill your details separately so that they appear separately. So you have a section to show them that you have worked in 4 different specialities. Don't represent that as a 1 year and then mention 4 specialties. Just use it as separate sections, like I have done in my application. Like I have done house officers in different specialties separately. Then afterwards, the most important thing is the supporting information. Like you have a separate section that includes what procedures you have done. So you can write all type of procedures you have done, from starting from simply doing a cannula, blood sampling, Foley's catheterization, doing to the high level like basic airway management, and then if you have done any surgical procedures.
Sami, you have 2 minutes.
Yeah. And then you have teaching experience to share. You can write details about your teaching experience. As Dr. Asif told you, that how can you conduct a teaching session? Then it's about audits, publications, and research. So as discussed in the IMT section, there's a section for everything you have to fill in related to your application that will not only help you in your trust grade job, but will also help in your training pathway as well. And then publications in the PubMed Index journal as well. And then if you have any distinctions, prizes, you can mention that as well. And then leadership skills, as discussed, that you can mention all of your leadership skills. Like I have conducted a BLS workshop, I was a rota coordinator, and similarly, I was a batch representative as well. So I have talked about all of this in my job application. So I'm almost reaching the end of my slide. So then there's an interview process that happens, which is like a structured pathway, which includes clinical as well as non-clinical questions. That's a whole new topic to discuss. But keep in mind that these includes clinical as well as non-clinical questions. And when you start NHS in your like early years, you have multiple problems you face. Like you have not been exposed to like electronic systems. You have not been exposed to the UK communication styles. There's difference in language, different in slang terms, different in the number of protocols. So clinical attachments do help in getting used to these systems. And then we can do the question answer section at the end.